I'm Dr. Diane Smith. I'm presenting on behalf of my colleagues Dana Rookstool, Dr. Melissa Pinkalski, and Jessica Willis. Our study was on the perception of male nursing student support. 10 years ago, the Institute of Medicine recommended to the nursing profession that the diversity in nursing should match the diversity in the patient population. Currently, about 10% of nurses are men, and the general population of men is about 49%, though clearly we've not met that goal yet. As well, the importance of increasing the number of men in the nursing workforce will help us address the current shortage, which is projected to continue. The Missouri State Board of Nursing in 2009 released some data that in Southwest Missouri, where our survey was located, that there are about 500 annual openings for registered nurses. And overall, there's a state vacancy rate of over 13%. Clearly an issue that we need to address. Our research question was, is there currently a difference of perception of male nursing student support between nursing faculty, male nursing student and alum, and female nursing students and alumni in nursing programs in Southwest Missouri? Our survey was developed based on 2 prior surveys done by Dr. Olin and Dr. Clark Ott. As well, we added some original questions. We developed 1 survey for senior nursing students and 1-year alum, and 1 survey for faculty. Both were distributed via the Qualtrics survey platform to 4 different nursing programs in Southwest Missouri. We had 4 categories of questions. 1 was recruitment, and then 4 subsets of retention, faculty availability, classroom opportunities, and clinical opportunities. The instrument was a 5-point Likert type scale, with a 1 representing did not experience, through a 5, a great amount, or experienced almost all the time. We had 1 optional open-ended text question at the end, which yielded a lot of interesting information, asking for specific examples from their perspective that would guide the understanding to improve the environment and transition to practice for males. Our results showed that there was a statistical difference between faculty and student alumni in the areas of recruitment and clinical opportunities. Within clinical opportunities, there were 3 questions that stood out to us, that faculty perceive that there are less assistance from clinical staff, the lack of variety of simulation roles for males, and the acceptance by patients. Also, faculty did not feel that recruitment of men was adequate, or that they would strongly encourage men to seek nursing as a career choice. But interestingly, both the male and female student responses demonstrated a confidence in their choice to become a nurse. Though definitely we see difference of perception there. Our open text responses indicated that all groups, faculty, male students, nursing students, male and female alumni, all felt that more clinical opportunities should be available to male students, particularly in the area of women's health. As well, it was noted that men's health is considered a specialty, yet it's not an opportunity experienced by students in the clinical setting. So there's much we could discuss from these results, but to highlight some of our findings is that it's important to consider the perception of both the faculty and the student alumni, and to include female students in that consideration to strengthen the overall recruitment and support of men in the program, and to assure that we are providing equal opportunities for both male and female students. So until our perceptions align, a change in practice will be slow or may be viewed as unnecessary. One faculty comment that we found quite profound is that, "I don't know, the survey brought new issues to my attention." So any perception of the lack of support of male nursing students may not be overt, but rather an uninformed omission. As well, we need to consider that faculty and clinical staff have the advantage of a long-term view. We have several cohorts of students, many have taught for many years, and may understand the clinical opportunities and the barriers that exist for men in a way that isn't available to students who are here for such a short time. To summarize, to address the shortage of nurses and increase the number of men in nursing, we must recruit and retain male students. And to retain them, we must support them. In particular, we should look at the area of clinical opportunities for them. Below you see our reference question. If you have any question, my contact information is at the bottom. We thank you for your time and attention.